right, a very good afternoon to you. I trust you are well. Thank you so much for joining us on this 11th day of January 2021. Now, this is News Desk, and my name is Grace Kuria. Once again, welcome to the broadcast. Now we begin with the health sector crisis in the country, which is still unfolding. Now this time around, clinical officers are marching to the Council of Governors offices in Westlands to table their frustrations after the COG refused to sign a return to work formula arrived at between the Ministry of Health and the Kenya Union of Clinical Officers. Now on January 1st, our Health and Sciences reporter Sada Hassan is on standby and now brings us to speed. Sada, good afternoon. Thank you so much for joining us. What's happening? I can see the clinical officers, they're marching behind you, but I actually covered the clinical officers on January 1st when they signed the return to work formula with the CS Health. And the CS Health did mention that that included everybody, the Ministry of Labor, the Council of Governors. What happened? What went wrong?
Good afternoon to you, Grace. I might not have heard everything that you have mentioned, but in regards to what is happening right now, these are the clinical officers. They're marching, heading to the offices of the Council of Governors, whereby they are going to demand to speak to the Council of Governors once they get to Westlands, because the return to work formula that was signed on 1st January did not go well with the Council of Governors, and according to the chairperson of the council, Wycliffe Oparanya, some of the issues that were agreed upon do not align with them, because this will result to a ripple effect within the county. Because if an increment of salaries or an increment of risk allowances is done upon to this particular cadre, the clinical officers, then it will definitely result into a ripple effect within all the other cadres, that is the nurses and the doctors. So this is just part of what is happening today. These are the clinical officers right behind me. I'm sure you can hear they're quite loud enough, and they're heading. This is a procession that started from Uhuru Park, whereby they had a few minutes to organize themselves and put forward some of the agendas that they will place once they get to Westlands. So this is just part of what is happening, and definitely once you get there, we will be able to shed more light on what is actually happening, and if actually the Council of Governors will listen to them.
With them, of course, as they head to the Delta House, that is the offices of the COG. But before I let you go, Sada, you've been following up on this COVID matters and this strike by the healthcare workers. Sada, these are the clinical officers. They were threatening to, go back to their strike. But we also know lab technicians are still on strike, not to mention what was supposed to happen in Mombasa today, but I am aware it has not happened. Private doctors were supposed to join the public doctors in their strike. Just what exactly is happening in the health sector? We are clearly staring at a paralysis.
All right, Grace, there's so much happening in the health sector right now because, as you are aware, some of the doctors in Mombasa County, that is 86 of them, were dismissed apparently a few days ago, and as a result, the Kenya Medical Council resulted into writing a letter to kind of hold on the process for a bit to cool off what was happening in Mombasa County. And as we speak right now, there are still talks ongoing within Mombasa County to try and cool off the whole issue that is happening in Mombasa County. But at the whole big picture is that there is a lot of issues within the health sector. The doctors, the nurses, the clinical officers, all of them are demanding they're all demanding for increased risk allowances, because bearing in mind at this particular period, we still have COVID-19 cases being recorded in the country, and these are the frontline workers who are there day in, day out in our hospitals, trying to reach out to Kenyans, trying to help the Kenyans. So these are some of the issues that they're highlighting, and they want it implemented such that if any one of them falls sick, that it will not be upon them to, actually seek healthcare or, pay for these healthcare services that they will be able to get in hospitals. But all of this should be upon the government to ensure that they take charge of these particular frontline workers. So it is a whole big picture, it is a whole big situation, and, we've been having back and forth. There is no clear answer, or there is no clear solution as until now. But today we know that here in Nairobi County there are also talks ongoing between the Ministry of Health, Ministry of Labour, and also some of the officials from nurses and the clinical functions, so that they can be able to try and bring solution to this whole situation that is crippling the health sector. Back to you, Grace.
Certainly, Sada, and thank you so much. I know you are with the clinical officers there as they head to Delta House, that is the office of the Council of Governors.